Thank everybody for being here. I'm here with leaders from the state of Texas, including the chief of the Texas Division of Emergency Management. We wanted to come to the lower Rio Grande Valley to personally observe and make assessments about the damage caused by Hurricane Hanna, as well as to visit with local leaders about how we can help them respond to the hurricane, as well as help them respond to the ongoing pandemic of COVID-19. I did have the opportunity to fly over the region and personally observe in different situations exactly the magnitude of the damage that took place. Obviously, there was some meaningful wind damage, but perhaps more prolifically, at least today, you can easily observe the flooding damage that continues to plague so many people across the entire region. The good news, however, is because of great leadership, because of great preparation, because people heeded warnings. The best thing that happened in the aftermath of Hurricane Hanna is that there have been no loss of life reported in the three counties in which we have county judges here today, which is Hidalgo, Cameron, and Starr counties. And so anytime you can get it through a hurricane without the loss of life, that is the primary goal right there. Now the goal is to do the best possible to very quickly make assessments about what damages are, about what the needs are, and for the state to step up and help address those needs. With us here also, where is Tony? The guy waving his hand. Tony Robinson, he is the regional administrator for FEMA. FEMA plays a prolific role in responding to hurricanes. Actually, FEMA is playing a very big role in helping us respond to COVID also. So having Tony Robinson in the Rio Grande Valley is very important for him to get to see firsthand about the challenges that exist, the needs that exist, and the funding that is needed to help people in the Rio Grande Valley respond to both of these challenges. We have with us today the county judges from Hidalgo County, Judge Cortez, the judge from Cameron County, Trevino, and the judge from Starr County, Vera. I appreciate them being here. I appreciate the opportunity to visit with them about what their needs are. We also have several mayors, but we have Mayor Suarez from Weslaco and Mayor Darling from McAllen. I'm proud to have with us today many of the state legislative delegation members, including Senators Hinojosa and Lucio, and Representatives Lucio, Dominguez, Guerra, Longoria, Munoz, and Martinez. And I appreciate their ongoing leadership both during the COVID pandemic as well as during the response to the hurricane. One thing that we were able to learn from our meeting were some obvious things, and that is the need for pumps, for example, whether it be in Hidalgo County or elsewhere, and our work to help accelerate the providing of those pumps. In addition to that, obviously there was a lot of challenges with regard to down power lines, and while we were in there, we issued a new waiver on my part to assist in part of this process. So moments ago, I waived certain regulations related to commercial trucking in the state of Texas. These suspensions will allow commercial drivers to more quickly deliver supplies, specifically electric power supplies, to communities in the Rio Grande Valley and the coastal bend impacted by Hurricane Hanna. The reason for that is, especially here in the Rio Grande Valley, that I heard from all of the county judges was the fact that there are ongoing power outages. And we were in communication with the power companies about what their needs were to accelerate getting the power back on. And by making this waiver of this regulation, it will provide those power companies another tool they need to accelerate that process of getting that power back on. We talked about people who were sheltered, whether they be in Hidalgo or other counties, and making sure that those who are sheltered will have their needs met. Obviously, we talked about what is clearly observed to be catastrophic agricultural damages and the need to take action to help address the agriculture losses and the agriculture damages. We talked in Starr County with the county judge there about roof damages as well as houses that are flooded, and there are more than 2,000 homes that are without power. We also had the ability to visit with the county judge in Cameron County about individuals there who are in need of shelter, and the state guard who are working to help provide that shelter, as well as the need for mosquito control. And then also we addressed challenges that they're facing with regard to COVID. And you got to hand it to the local leaders. It's an enormous challenge for any local leader to step up and be able to address the challenges that come along with a hurricane. It's even more challenging when you couple that with a pandemic. Our biggest concern with the hurricane was the challenge that it posed because of the pandemic, especially in the Rio Grande Valley. And if there's one thing that I want to emphasize to everybody in the entire Rio Grande Valley, it is this. This hurricane has not eliminated COVID-19. COVID-19 still exists in the Rio Grande Valley. It can still be easily transmitted in the Rio Grande Valley. Any type of gathering of just a few people provides an opportunity for COVID to spread from one person to another. It is essential that everybody understand the necessity now more than ever to take every precaution that you can to make sure that you do your part to slow the spread of COVID-19. That means avoiding those gatherings. It means avoid going to bars and settings that put you in close proximity to others. It means staying at home if at all possible. However, we know that part of the challenge that you deal with in the Rio Grande Valley is the challenge with health care. And so I'm making several announcements today to help the Rio Grande Valley better deal with the health care challenges that are posed by COVID. We are announcing first, I want to express my appreciation to Mayor Darling of McAllen, because we're announcing that we are opening up the McAllen Convention Center that will be converted into a healthcare facility. The maximum number of patients that it could be able to handle will be 250 patients. That maximum number will be determined by the level of acuity of the particular patients, and so it could change. It is intended to be able to address the local needs that exist in the current hospitals. It will be open later this week. It comes with hospital beds, medical equipment, and medical staff in addition to just the location. And so this is going to be a single location that a large number of patients will be able to go to. In addition to that, there are multiple locations that are either open already or that will be open this week that will provide additional locations for COVID patients to go to, especially those who are in the recovery mode. They are called step-down sites. One is in Laredo that will provide capacity for more than 100 patients. Another is in Farr that will provide capacity of 20 people to start, up to a total of 40. Another, which will be coming here in the coming days, is in Harlingen. And then we are still working on a site to be determined for a facility like this in Starr County. In addition to that, we are also announcing today additional medical staff coming to this region. The Department of Defense has deployed additional medical task forces to communities in the Coastal Bend and Rio Grande Valley to help combat COVID-19. These are 85-person teams that consist of medical and support professionals who will help meet medical needs in hospitals and in the communities of Corpus Christi, Victoria, Harlingen, and Edinburgh. Today, an additional U.S. Army Reserve unit has arrived in Harlingen to support two hospitals. One is Valley Baptist Medical Center, and the other is Harlingen Medical Center. Additionally, tomorrow, there will be an additional U.S. Army Reserve unit that will arrive in the Rio Grande Valley to begin assisting hospital personnel at DHR Health in Edinburgh. This is on top of the more than 2,000 medical personnel that we have already allocated to this region to assist in the healthcare needs of this region. Bottom line is this, and that is the state of Texas will work with both our federal and our local partners, as well as private entities, to ensure that every healthcare need of every person in the Rio Grande Valley is going to be met in response to either COVID-19, Hurricane Hanna, or any other crisis situation they are dealing with. I'm proud to have the opportunity to work with these leaders here, and I'm also proud that we are being led in our response effort by the chief of the Texas Division of Emergency Management, NIMKID, to whom I will turn it over at this time.
Thank you, Governor. And I'd like to start by acknowledging and thanking all of the healthcare workers that have been in the hospitals throughout this pandemic, but also throughout this hurricane, putting their patients first above their own safety. So please, if you see one of the healthcare workers across this region, thank them. Second, thanking the first responders and the local officials, many who are standing behind us. I want to thank the citizens that actually followed the guidance and suggestions. It is amazing to go through a storm like this and not have a loss of life due to flooding or due to the storm damage. And I know we've had some other losses of life from some other incidents, but when you talk about the storm damage itself, and it's unusual that we go through an event without that. I want to thank the thousands of personnel that have come from across this nation. They've left their regular jobs, they've left their support and family, and coming here to provide health care services to the communities here. And thank the members of the Texas Army and Air National Guard who are out there working on the front lines, as well as members of Texas A&M Task Force 1. Our priorities will always be life safety, property conservation, and environmental protection. And Governor, I think the team around us has done a great job of that. Thank you.
Thank you. County judges.
Who's first? Okay, I guess I get to go.
Get in there, Judge.
All right. Good afternoon, everybody. Governor, thank you for coming down to the Valley, especially in this time of need and crisis. I think it's fair to say, we discussed this earlier, that in Texas we can walk and chew gum at the same time. If we can deal with the pandemic, we can deal with the natural disaster. Thank God we had no loss of life from Hanna, but the flooding and the water damage over a short period of time indicates both the short-term and the long-term problems that we have to deal with from a flood and infrastructure standpoint. So we appreciate your commitment to help us on these regional and local projects that we've been trying so strongly to address for many, many years. The people that are suffering right now, that have lost their homes maybe several times over the last several years, it's heart-wrenching because of the fact that they don't have the resources to continually rebuild their homes. Thank you for your support in supplying the needed resources at our shelters. It's an interesting point that our shelters were not overrun by individuals. I made the comment to you that it may be COVID related. People were concerned about being in a closed space with everybody, with other people, and that's a byproduct of COVID. But and contrary to popular belief, none of the county judges asked that Hanna come in order to force people to stay at home this particular weekend. Again, that was just a byproduct. But we shouldn't need a natural disaster to have everybody do what they need to do in order to fight the spread of COVID-19. So we appreciate your efforts, and thank you for being here, and we look forward to continuing to work for you, for the Valley and for the state of Texas.
Thank you, Judge.
Well, Governor, also on behalf of the citizens of Hidalgo County, we want to welcome you again to our area, and Chief Kidd, and thank the Highway Patrol for hosting us here in this facility. It really was a pleasure to be with you here today and see your willingness to listen to us about how we responded to Hanna, how we responded to this pandemic. You were very interested in knowing exactly and to the highest detail possible of what our needs were. And you have always been very responsive in giving us those resources and those tools to battle this. I also want to be one of the first to thank you and congratulate you for the alternative care facilities. Let's give them a big hand. Let me tell you, the hospital groups and the municipalities and the county have been talking about those alternative care facilities, which are extremely needed to increase the capacity of the hospitals. We have close to 2,000 rooms in our hospitals, and more than half of those rooms are occupied by COVID-type patients. So having this tremendous access, and not only having the access, but all of the medical people. One of the biggest problems that we have is the need for more medical people, such as doctors, nurses, and other technicians, and thank you so much for that. He even asked us about whether we were concerned about mosquito control, and we said, yes, Governor, so whatever you can send us to help us with that, we're going to appreciate it. But again, on behalf of a very appreciative group of people here in the Rio Grande Valley, we want to thank you very much, Governor.
Sure. As one quick example, one thing that he asked for, he said he needed oxygen, is it concentrators?
Oxygen concentrators, beds.
And IV pumps. And we said he will be getting all of them tomorrow.
Tomorrow. Thank you. Thank you, Congressman. Governor.
Thank you.
Governor, I guess I'll reiterate what the other county judges just said, and most of all, we want to thank you for, I guess, the support and interest that you have shown to the Valley. We're very grateful for that, especially in Stark County. What you mentioned about the facility in Hidalgo and Cameron that will become available for health care, for us, that's music to our ears. The problem that we have, as we discussed a little before earlier, is the capacity of our hospital. By having these facilities in Harlingen and McAllen, that will help Stark County tremendously, because Willacy, Hidalgo, Cameron, I can proudly say have been extremely great neighbors with Stark County. We work together as a region, and we help each other whenever possible. So this is going to help our hospital considerably. And, in fact, the things that I asked for mainly were for hospital needs.
For them, yeah.
So, again, thank you, Governor, for your help, support. Chief, thank you also for always being there and answering our questions. And to the people of Stark County, please don't go out unless you have to. Thank you, Governor.
Thank you, Judge. We'll take a few questions.
Good afternoon, Governor. Could you talk a bit more about the McAllen Convention Center conversion? And is this for acute patients or a step-down facility? And is this the replacement for what Samaritans first had come down here with intention?
So the architect behind all of this and the person who's put it together is Chief Nim Kidd, and I'm going to have him answer your question.
I think I heard the part of the question about the convention center, a little bit more of the elaboration. This is going to be a federal medical station. You've heard the term before probably. And really it's designed to go anywhere from 50 beds of acute care to 250 beds of non-acute care. Our goal is the rest of this gets set up today, and it's being set up right now. Pharmaceutical cash will be delivered soon. The doctors and nurses will come in and staff it later this week. But our goal is to work with the hospital CEOs around here to determine what the greatest need is. We want to be very flexible. I don't want to be rigid and set up only acute care if that's not the need, or non-acute care if that's the need. So flexibility is the answer of the day right now, and our goal will be to get in here quickly and work with them to load balance patients for the patient's best interest.
So, as a follow-up, the medical staff will become more medical staff. You mentioned 85, so you probably going to send more than that?
Oh, yeah.
There will be more than 85. 85 is the one of the teams that's coming in from the Department of Defense. But again, and I think the governor mentioned, we have over 6,100 contract doctors and nurses in the state of Texas right now. Well over 2,000 of them are just down here in the Rio Grande Valley. More will be coming as needed, but we want to work in load balance where we've put nurses and doctors in places before. If those hospitals have started seeing in the crest, we will move those doctors and nurses out and get the most effective or maximum use out of them as we can. The ideal is to be able to load balance where the need is in real time, or as near real time as possible.
Governor, this is the third year that we, residents of the Valley, have been seeing flooding. We had June 2018 floods, June 2019 floods, and now in July we're seeing this again. This is the third time some people, very low income, are having to rebuild their homes. What can you tell us about that?
During our meeting that we just got out of, I would say that was the primary issue that was discussed. And a lot of discussion, there was information provided to us by the local officials the state elected officials, the state reps and state senators who are behind me. This is an issue that they have been working on with me and with the legislature for the past several sessions as we work toward finding the solution or solutions that will fully address this. And so we did hammer out the issue. We did talk about several solutions in that meeting, still looking for the right solutions, and it's something that we understand we need to move toward quickly. And the good news is it seems like we have agreement to work collaboratively toward making sure this is going to be finally and fully addressed.
Are we going to expect something similar next June, July?
Well, here's the goal is you should expect solutions being delivered. Understand this. When you start delivering solutions that involve containment or movement of water, it takes typically years for those projects to be completed. If you look, for example, at the Harvey recovery projects that are taking place in Houston as we speak, they've been going on a couple of years. My point is, what you need is a solution quick. We know the completion of it needs to be even quicker, but I know it takes a little while to complete these very large construction projects.
Just so we have an accurate count of who's coming in, you mentioned the 85-person team. You also mentioned Farmington and Edwards, and you mentioned the Department of Defense. So just so we have an accurate count, who's coming in, and how many do we have currently who've also come in to assist?
Chief,
So I can help with that. Again, over 2,000 people in the region. Several of the 85-member teams are already here and working. And I think it might be best if we put together a graph or a chart for you that'll break that out, and we'll pass that back around after the press conference so that you can see where they are. Now, again, that'll be a snapshot in time. Our goal is to help the hospitals load balance even between the systems back and forth, because, I mean, it's really complicated how nurses work in a hospital, who comes in, who doesn't, and how they load balance it out. And so I'm a little reluctant to give you the map to say this is how it's going to be tomorrow. We can give you what it is today, but know that, again, over 2,000 contract and DOD and HHS staff are here, and as more are needed, more will be deployed.
just looking at some very quick math, if you look at the teams that are coming, so there's 85 people per team. If you look at the teams coming, as well as the additional staff, whether it be for the step-down facilities or for the McAllen Convention Center, et cetera, you can easily say hundreds of additional medical staff will be coming.
Governor, is there any chance of an enforceable lockdown or shelter-in-place coming back by the pandemic?
So what we want to do is we want to make sure that we achieve what is necessary to be achieved so we are able to slow the spread. The good news is, looking at data, it seems as though the numbers of people testing positive are beginning to decline. And I think reasons for that include people beginning to wear masks, people no longer being able to go to bars, people finally really accepting the reality that COVID is real and they need to avoid transmitting COVID. One other thing is people are realizing that COVID can spread in small gatherings. So we did talk earlier, and we will continue to talk about strategies that can be used in the Rio Grande Valley to help them address their situations. I do, however, want to emphasize this one point. Whatever standard is going to be employed, let's say everyone was required to stay at home. We are seeing transmission of people who are in families who gather together at home. So know that if you're all just one family, and which could be 25 or 50 people, and you gather together, that can be a setting where transmission can occur. So everyone needs to understand how transmission can occur, and everyone must do their best right now to make sure they prevent that transmission from taking place.
Governor, I wanted to ask, I know you said it's going to be kind of like a projection. You're going to be evaluating the situation as we go in the coming days and weeks, but what will be that, I guess, factor for you? Like, how will you determine whether or not a stay-at-home order that counties are able to enforce themselves, how will you make that determination, and why was that not a consideration like 2 weeks ago when locals and other people have called for that?
When requests were made, candidly, around the state of Texas for a stay-at-home order, I knew at that time that we still needed to see the results of the mandatory mask requirement that I put in place, and the results of shutting down bars, which were settings that led to transmission. The mask order went into effect on July the 2nd or July the 3rd, and it takes several weeks to see the results of that. If you look at the numbers, primarily in the large counties across the state of Texas, you see that several weeks after those orders went into effect, there began to be a decline in the number of people testing positive, as well as a decline in the number of hospitalizations. Over the past few days, we've seen it decline even more in the number of people testing positive, and the positivity rate, as well as the hospitalization rate. So we are seeing positive results from the executive order that I put into place that did not force people into poverty by forcing them to lose their job, lose their income, lose their ability to earn the paycheck they need to pay their bills and put food on the table. So it's a balance of making sure that we're not forcing people into bankruptcy, making sure that people are able to buy food and pay rent like they need to be able to do, while also containing the spread. Now we have seen a greater decline in counties outside of the Rio Grande Valley, which is why I'm working with leaders in the Rio Grande Valley to find solutions that will work for them.
Moving forward, how will you determine, whether, something like that would be allowed for county officials?
Sure. Well, we look at all these factors that we have been looking at and see the extent to which they get exceeded. One factor, the beginning factor, is how many people are testing positive. What is the trend of that? Are more and more people testing positive each day, or is that number declining? Then we look at hospitalizations. Obviously, we have maintained a daily watch of the hospitalizations in the Rio Grande Valley, and we knew when it was stressed. We knew responses that need to be taken, and we are seeing some glimmers of positive results from the response that has been taken. So the hospitalizations are a precursor to fatalities. Our ultimate goal is to reduce fatalities. And to achieve that ultimate goal, we need to reduce hospitalizations. To reduce hospitalizations, we need to reduce the number of people testing positive. So all these things work connected together. But I would say the ultimate factor among those would be hospitalizations. When a community is unable to provide the hospital capacity for people in the community who may become ill, that means that additional action needs to be taken. I'm proud to see the way that leaders, whether they be elected leaders or medical leaders or community leaders, have come together and worked together to make sure that the hospitals and healthcare facilities provide the care that is needed for the people in the community, and they have been able to overall reduce slowly the number of people who are hospitalized. Now that we have all these additional resources that we're talking about today, that will further alleviate the strain on the local healthcare facilities and hopefully provide the care and settings that are needed for everybody in this entire region to make sure that their healthcare needs will be addressed.
Governor, in Starr County, since the county stopped providing free tests, we have gone periods of time, 5 days, 4 days without testing. What can you do to assure that the people in Starr County can have the proper test sites so that we can make sure that the reason the numbers are not going down is because we're seeing a down
Sure.
side in the curve versus we don't have tests
Sure.
available?
So we will be surging testing to make sure that this region will be able to be fully tested. The reason why I say this region, Starr County is part of it, but Starr County, Hidalgo County, Cameron County, Willacy County, the entire region, we want to make sure is going to be fully and adequately tested. There's no way that we can achieve an adequate determination about the magnitude of the challenges that exist on the ground without doing that testing. Hence, we will be surging testing here. As I said last week when I had my video conference with the county judges, Texas's #1 priority right now, #1 focal point with COVID is the Rio Grande Valley, and we will put the medical resources, the testing resources, and other resources here to make sure the needs of this community will be fully met.